Joining me now is Urgent Care Medical Director, Dr. Curry-Winchell. She is extraordinary, and she's here with us right now to help us break some of this down. It is, of course, National Heart Health Month. So many women are having heart attacks and don't know it because the symptoms often appear differently than what we're used to or what we expect. Hormonal imbalances, for example, could even trigger it. What should we be looking out for?
So with women, we tend to have silent or atypical symptoms. Normally, what we hear about is chest pain or shoulder pain. However, with women, it can be fatigue, it can be flu-like symptoms. And we can't forget, from an equity standpoint, there is this level of dismissal that we have often heard about with women when they're seeking care. And so if you are, a woman who has first any family history or just not feeling like yourself, it's important to get your heart checked out. And if you are dismissed, go to someone else and have someone else take a look, because you've heard me say this many times, your health is your most prized possession. So if we want to move that needle and reduce these rates of complications or heart attacks, especially with women, we have to advocate for ourselves and really honor the symptoms or the things that we are feeling.
What can we do to reduce our risk of heart disease? I get the symptoms thing and looking out for it, but obviously we want to get to people before they get the symptoms. Is there something we can do in terms of exercise, diet? What do we do to reduce the risk?
So thinking about preventative health, thinking about what you eat, because what you eat really can impact your ability to live longer. So preventative measures, knowing our family history, and also just getting checked out when you don't feel well.
From the heart to the mind, let's jump real quick before we go. A new report revealed hospital workers often witness minority patients being mistreated. In one case, a black nurse noticed colleagues withholding sickle cell medication. In another example, workers heard colleagues making disparaging remarks about Native American patients. How can patients advocate for themselves if they find themselves in a situation like this?
Well, two-part. If you are a colleague and you hear that there is bias or you see it, stand up for that patient in that moment, because that can make a difference between life and death. And when you talk about patients, the big thing is, if you feel that you aren't being heard or you're being dismissed, it's important to seek out a health advisor, a patient advocacy individual in that hospital system, and know that what you're feeling is something that you have the right to advocate for, and don't doubt yourself. And I think when we talk about advocacy, we have to really think about what you can do in that moment. And the first thing is, don't doubt your feelings and find someone who will listen to you.
That's it. Find someone that will listen to you. It has to happen, because we cannot continue to go the way we have, which has just simply been an unacceptable level of mistreatment at hospitals that's systemic and foreseeable, sadly. Anyway, Dr. Curry-Winchell, I want to thank you, as always, for sharing your expertise with us.